Yes. MSH2 is a DNA repair protein, and adjuvant-based chemotherapy is now standard of care after surgery for lung cancer. But the important point is that not every patient benefits from this chemotherapy. And the long-term benefit appears very modest since the IALT recent update with the long-term survival data. By measuring MSH2 in tumor cells, we tried to figure out which patients were most likely to benefit from this chemotherapy. Sorry. So to do that, we studied a subset of 673 patients. MSH2 was evaluated in tumor cell by immunohistochemistry, and then MSH2 expression level were correlated with long-term survival data and to chemotherapy. In the cartoon, there is a lesion between DNA and cisplatin, and MSH2 in red recognizes and binds the lesion. Then it recruits other proteins that excite the lesion. So when MSH2 is low, the lesion is not repaired, the sensitivity to platinum increases, and one expects a clinical benefit. This slide shows the adjusted hazard ratio for death in the Cox model when comparing chemotherapy versus no chemotherapy. And when the hazard ratio is less than 1, patient benefit from chemotherapy. When MSH2 alone was low, chemotherapy reduced the hazard for death by 25%. ERCC1 is the second previously known repair protein. When ERCC1 alone was low, chemotherapy reduced the hazard for death by a similar proportion, by 27%. And when both MSH2 and ERCC1 were low, there was a further reduction in the hazard for death by 35%, indicating a substantial benefit from chemotherapy in this patient. And this benefit was larger and more likely than when only one of the two proteins was expressed at low levels. And finally, when the proteins were expressed at high levels, there was no benefit from chemotherapy. So now we see the long-term survival curves. In patients with low MSH2, the chemotherapy group, indicated in blue, survived longer than the control group, indicated in red. And the difference was 16 months in favor of chemotherapy. And also, when both MSH2 and ERCC1 were low, there was a gain of 21 months in favor of chemotherapy. In contrast, on the right side, there was no gain of survival from chemotherapy when MSH2 was high or when both MSH2 and ERCC1 were high. So MSH2 expression was able to identify patients who benefited from chemotherapy, and MSH2 combined with ERCC1 further identified patients who were most likely to benefit from chemotherapy with a gain of 21 months in favor of chemotherapy. So we believe that your use of DNA repair protein as markers may be a step toward a more personalized therapy after surgery for lung cancer.